Welcome to this Autism Ontario webinar, Equity-Based Promotion for Black Mothers of Children with Developmental Disabilities, Consideration for Practice and Policy during COVID-19 Pandemic and Beyond. The topic is a mouthful, but it's also a very important topic for the world that we live in today. What is an inclusive approach to health promotion? We will share the findings of a qualitative study of the challenges and strengths of Black mothers of children with developmental disabilities. We will also discuss recommendations from the Approaches to Care section of the 2018 Canadian Consensus Guidelines on Primary Care for Adults and Intellectual and Developmental Disabilities, and provide suggestions for improving diversity and inclusion within the places where we practice and receive care. Now, this webinar is just a little bit different than the ones that we commonly run in that this one is going to be pre-recorded. So throughout the presentation, I still want you to fill up that Q&A box that's right below me with questions. And as we move through it, I'm going to aspire to get you answers at the end of the presentation. And those answers will be coming from our faculty today, our presenters. First up is Dr. Yolanda Neal. First time doing a webinar with us, is that correct?
This is my first time. I'm very excited.
Dr. Neal is a family physician at the Scarborough Centre for Healthy Communities in Toronto, and we'll be joined today by Dr. Nazila Kanlu. Dr. Kanlu, welcome to the Autism Ontario webinar desk.
Thank you very much. I'm excited as well. Looking forward to it.
Excellent. Okay, so one last thing before we get started, and that is we've got a couple housekeeping items. First off, as mentioned in my introduction, we are pre-recording this, but we are going to be pausing to answer your questions. So please fill up that Q&A box. We'll be keeping track of them, and we're going to come back live at the end to answer all of those questions. Also, if you have any issues, click on the help icon, and there will be some resources that you will be able to access in the resource center or the handout section at the bottom of the screen, and they will help inform our conversation. All right, so with all that being done, I'm going to welcome back Dr. Kanlu. Dr. Kanlu is a PhD and in the Women's Health and Research Chair in Mental Health Facility at York University, as well as the Associate Professor in the School of Nursing, keeping very, very busy. I'm going to start with a simple question for you before you take us through the racialized mother study and the introduction there. And I want to ask you why you think this is an important topic for us to cover today.
That's a great question, Matt, and we addressed that in part in the first part of our presentation. We feel that issues of diversity, racialization, looking at the needs of various communities are important, both Dr. Neal and I, and we hope that this webinar supports this aim.
Okay, well, with that, then I suggest that we get started with our opening section. So I'll hand it over to you, and we'll pop back in as required and as needed.
Thank you so much. I want to first thank Autism Ontario for inviting us to be a part of this webinar. The outline that we propose to follow is I'll be talking about the racialized mother study, and then we'll have a Q&A pause, and Dr. Neal will then talk about some of the practice and policy recommendations, and in particular in relation to COVID-19 as well. And then we'll have a concluding part to our webinar today. And in the middle there too, there'll be again a Q&A period. Looking forward to your input on that. So we know that issues around diversity are important. Autism Ontario itself says that, quote, as more research is being done on the intersections of autism and race, gender, sexuality, and social locations, more information is being made available online, which is increasing the rates of autism diagnoses in children and adults. So, you know, Autism Ontario itself refers to intersections, and we're influenced by an intersectionality perspective, and I'll be talking about that shortly. Going back to the quote, this in turn is placing a larger demand on education, healthcare, and social services systems, highlighting glaring gaps in the supports available, especially for autistic adults, people with lower incomes, people in rural areas, and Black, Indigenous, and people of color. So we hope to fill in a part of this gap, perhaps a small part, but we feel it's an important part in drawing from our work as researchers, as clinicians, and in providing some recommendations. And so I just referred to intersectionality, and some of you may be familiar with this term, others may not. When I teach about it to my students, I say keep three things in mind. Intersectionality recognizes that our context makes a difference, and it impacts what identities are important and meaningful for us. And all of us are, depending on the context that we're in, have little or more or no power at all. So these are some of the important ideas of intersectionality. And for those of you who are interested to read a bit more and know more, I'll be referencing an e-module at the end. But it does draw from the seminal work of Professor Kimberly Crenshaw, who's among the founders of critical race theory. And she coined the term in 1989, and others have written about it as well. So we at my office have for years conducted projects in which we are particularly interested in the experiences of immigrant mothers, mothers from diverse backgrounds. And on this slide, you see the recruitment flyer from a couple of our previous studies. Earlier on, we were interested in hearing about the voices of immigrant mothers of children with disabilities. And then that study led to one looking at what do mothers themselves do to look after their own health in the context of raising children with developmental disabilities. And through our studies, we learned that we need to focus more on racialized mothers. We heard from the community that we need to particularly focus on experiences of Black mothers. And so we conducted the study that I'll talk about very shortly. All of you know, whether you're service providers or parents or educators or persons with disabilities, that in the context of raising children with disabilities, there are multiple roles for parents. It's not just parenting, but it's also can involve quite a significant amount of caregiving experiences. And there's always the need for advocacy in terms of getting the services and the supports that is needed for children. So there's all these multiple roles in addition to traditional parenting roles that parents take. So next slide is the team members on our racialized mother study. So I'm grateful for the amazing team, and it's most of our studies are very interdisciplinary in team membership. And in terms of the study that I'm talking about, we were in general interested in what is an inclusive approach to health promotion for racialized mothers of children and youth with developmental disabilities. So that was our overall interest and focus. And we wanted to interview both service providers as well as Black mothers taking care of a child or children with developmental disabilities. So you'll see on that slide that we have a recruitment flyer for mothers and a recruitment flyer for service providers. This was a qualitative study, and we weren't interested in large numbers. We were interested in interviewing folks who would give us rich data through interviews. And so it took a while to recruit mothers into our studies. We were very lucky to have 7 mothers who participated. We also interviewed 3 service providers. And just to let you know that this study took place before COVID-19. It took place between June and September 2018. The next study provides some of the demographics of the mothers. Most of the mothers were from the Caribbean, and 4 of them were born in Canada. Most were single. The number of children with disabilities range from 1 to 3. It was quite an educated group of mothers who were in our sample, but despite their education level, 4 of the 3 were unemployed. In terms of the disabilities of their children, again, there was a range. There was of disabilities that were related to developmental disabilities. And in terms of a self-identified racial and ethnic background, there were from African American, African Canadian, Black, Afro-Caribbean. So these were how the mothers self-identified. Now, in the next slides, I'll be, instead of talking about the mothers, I'll be bringing their voices through the interviews that we conducted into the presentation. And so I'll be directly sharing with you what the mothers said. I'll be first talking about the challenges, but I'll also then later talk about the strengths of the mothers as well. So one mother said, in relation to mothering in the context of raising a child, I'm really stressed out all the time. It's affected me. I did stop working, but I don't feel good about it. I'm very worried about everything. I'm struggling financially. I'm going to court next week with a tenant board. I'm just overwhelmed. But even when I work, I feel it's impossible. It's impossible with 3 kids. The next slide is from another mother, and it talks about the additional challenges of mothering children with developmental disabilities. She says, I now know that I have to sacrifice a lot for them because they can't speak for themselves. My son can't articulate how he's feeling because of his learning disability and stuff like that. So I know that I have to be there to help him. As for my daughter, who also had a developmental disability, I make sure she has everything she needs, that she doesn't have to too much depend on or have people treat her differently because she's a certain way. I make sure she's where they are, people that really care about her. So I don't leave her with just anybody, but overall, she's talking about the need for her patience and understanding. In the next slide, then I share with you, in addition to the mothering of children with developmental disability, what racialization or experience of being Black mother is experienced as. This mother talks about, well, I was just annoyed. Like, I don't think the doctor had anything to do with it. I just thought the guy that was serving me, he probably was just a little bit racist. I think he wasn't just serving me, and he probably didn't check me in and probably just had me waiting there because he probably didn't want me to get the health service. I don't know what his past experience or whatever was, but maybe he didn't want me to get the treatment. Another challenge is getting limited or no support from one's community or family or friends. And this mother says, my support, I don't know right now. I know there's community support, but personally I'm withdrawn. My family is not supportive. They don't know how to be, I guess. Right now I'm not really doing much, and I'm stressed out about finances. One mother, the same mother actually that I just quoted from, talked about the importance of intergenerational awareness and education about racism. She said, I just find that my experience, I like to let my kids know what's really happening, make them be aware that racism is real and that they shouldn't allow certain things to happen, because I believe I wasn't really warned about my parents' experience, a lot of racism, and they didn't tell me until I was a lot older. Like, my mom got strip searched by the police. They accused her, says she was a man, and strip searched her and violated her rights. She never told me these things until I was much older, so I like to let my kids know, give them examples of little things so they know what's racist and what's not and what's acceptable. In the next slide, we'll talk about some of the strengths of the mothers. And one mother talked about having a holistic approach to a better society. She talked also about exercising good thoughts, good thinking habits, kindness, having love for people, regardless of how they feel about you. This is our first question for you, the audience, perhaps to reflect and to share with us in terms of your perspectives, your comments, and that being that, in your opinion, what are some of the strengths and challenges of mothers raising children on the autism spectrum?
So you can go ahead and you can submit your comments. You can submit also in the same box that you're going to be utilizing to submit any of your questions or comments and the like about the presentation. And we will be looking at those towards the end of today, as we mentioned, once we get through this recording. What, if anything, for you, Dr. Canlu, what if anything was the most surprising thing that came out of this study for you personally?
Well, in terms of just the amount of commitment that the mothers have to provide as a meaningful experience for their children, despite the tremendous challenges that the children face, either vis-a-vis the education system, their social relations, and despite the tremendous challenges the mothers face in terms of, if you recall, we had a highly educated sample of mothers, and most of them were unemployed. So the very challenging finances that they faced. So trying to create as best of an environment for their children while they're growing up, while at the same time trying to navigate multiple challenges in society, whether because of feeling treated differently, whether because of challenges acquiring the finances, the services, equitable education. So those weren't surprising to me, but the strengths of the mothers, given the challenges that they face, was quite admirable, but also got me thinking, how could we do better as a society? How could we do better as service providers? How could we do better as educators? For those of you who are interested, we have created a very brief video of the project, and the link is there in our PowerPoint. So it's just over 3 minutes. If in the future you're interested, please take a look at it. So the next several slides, I'm going to share with you some of the practice and policy recommendations that the mothers themselves shared with us. And again, I'm going to draw directly from the quotes of the mothers. So in terms of training, education, and awareness for service providers, one mother said service providers need to know that racism is embedded within a social structure within Canada, and that racism limits people's access to certain services. And once they're aware of this, they would be able to know how to advocate on behalf of racialized people. So very important and powerful comment from the mother. Another mother suggested, in terms of participation and inclusive decision-making, by speaking with these people and finding out what their needs are, finding the people with those issues, because they would know right, they would know better right, formulating that plan and educating whoever is actually experiencing those situations and training them how to help other people with those situations. So there were other recommendations too, such as service providers with diverse backgrounds, more information about services and more programming about services, and a specific hotline to support the mothers themselves. So a specific hotline for mothers. So in general, again, just if we look at these different issues coming in, and just going back to the question that Matt posed shortly a while ago, mothering at the intersection of being a racialized mother, and then on top of that, caring for children with developmental disabilities and the usual challenges and opportunities of being a mother, really creates a particular experience for moms who are from racialized backgrounds. I think I'd also like to, at this point, thank Women's College Hospital, who funded our project, as well as the mothers and service providers who participate in the study, as well as Ms. Jamila Gamble, who, if you take a look at the video, you'll see that she narrates parts of the video. At this point, I'd like to hand it over to my colleague, Dr. Neil.
Thank you very much, Dr. Canlu. Dr. Neil, before you get started, just so I don't interrupt your flow, I just want to ask you if what you found most surprising as you went through the study or at the conclusion. What were the things that maybe jumped out at you that you weren't expecting to see?
I think even just the suggestions that the mothers provided, and it reminded me, just even as a service provider, that we do need to actually hear the voices of the people that we're taking care of and working with, because there's a richness of idea, right? And
right.
We can come up with a lot of things on our own, but the answer is right in front of us. Right.
Well, that's very good for our audience. I know any parents and caregivers that are out there, we often talk about advocacy and making yourself heard and how important that is for others, professionals and the like yourself. Okay, I'll get out of your way and let you get into your presentation. A reminder to everybody that we will be taking your questions at the end of the session, so fill up the Q&A box and we'll be reviewing them so we can get back to your answers once we conclude. Go ahead, Dr. Neil.
Thank you very much. So I am going to pivot a little bit for a second. I just wanted to share that I was lucky enough to participate in the creation of the Canadian Consensus Guidelines on the Primary Care of Adults with Intellectual and Developmental Disabilities. And this was created under on the direction of one of my mentors, Dr. William Sullivan from Surrey Place Centre. And the guidelines are for physicians and nurse practitioners. They outline the standards of care, what's expected for all kinds of clinical encounters. And so they do focus on physical health and mental health, but today I'm going to be looking at the approaches to care section as it intersects with the things that we're discussing today. So the guidelines are their own separate document. But there is a wonderful website which has the guidelines embedded and a suite of tools associated with it. The tools are for both caregivers and primary care providers. And so if anyone would like more information, there is a link available in the resources. Let's look at a person-centered approach to care. When I looked at the conclusions of Nazila's study, it made me reflect on my own interactions with caregivers of patients with intellectual disabilities and autism. I think many of my patients share the same narratives, but I wanted to know, how could I understand their primary stressors? So what's actually happening at that point of intersection between being a mother, being a racialized person, all these things and I wanted to understand, because I recognize that if the stress is too great, we know that it doesn't matter what I say as a doctor, the family's not going to be able to follow through with my recommendations. They may still miss the appointment for the ultrasound or not follow up with that behavioral therapist when I ask them to. And as a caregiver, I can imagine how frustrating it might be if the doctor is creating plans that are impossible to carry out, right? Based on the stressors in your life at the time. So I know that my patients face many barriers. They may have limited or access to service or partial service provision. They may find that they have intensive processes to register for services, like having to fill out a 20-page booklet or do a 45-minute interview on the telephone. I need to understand where patients are coming from when I'm giving them suggestions. In the clinical practice guidelines, they highlight the importance of a person-centered approach to care. And so it's a framework. It doesn't mean that the patient gets to do just whatever they want. It means that the patient understands why a clinician is making a certain recommendation, and they can participate in the plan of how it's going to be carried out. And so that's how it should look when you get to a clinic visit. So how can you make this actually happen? I have a few suggestions. in coming at this either as someone who's receiving care or someone who's providing it, you can see what you should be advocating for. The first thing is to engage patients and caregivers. So the first suggestion is to understand the level of function of the patient with intellectual disability or autism. This might be as simple as explaining some of the things that they can do on their own at home, their ability, like their level of ability to communicate and speak, so that the physician or nurse practitioner understands what suggestions make sense. Also, using tools for communication during the clinic visit is very helpful. Something that I do all the time. So I like to use visuals. I don't use videos that often, but I could. Some people like to use drawings. I love using easy-to-read handouts. For myself, I'm a member of the Canadian Medical Association, and we have access to Clinical Key that has handouts that are also translated in multiple languages. So it's a very handy resource. Also using office organizational tools. So this has become more common since COVID started, but limiting the amount of time in the waiting room. So presenting the option of saying maybe you could wait in the car until the clinic room is available for people who feel agitated in a crowded waiting room. Or asking for visits at a specific time of day that might be less likely for the clinician to be behind. At my clinic, I am always behind, but except for the visit at the beginning of the day and right after lunch. Those are some of the best times for me. So you might want to ask the clinic staff if there's an opportunity for that too. I also like to use a form called Today's Visit. Sometimes they also call it My Healthcare Visit. It's available on that same DDPCP website that I showed earlier. They have a summary in simple language explaining what happened at the clinic visit that day. And it's very handy to take home and review what you've been discussing. It's also important to identify a support person. So in medicine, one of our principles of medicine is patient autonomy. So that means that we recognize the right of patients to make their own decisions if they're able to do so. And I do spend time in clinic visits allowing my patients with intellectual disabilities time to discuss private issues on their own if they're able. But I believe that bringing someone along who knows the patient well is a way to support autonomy, because you're allowing the patient the ability to understand better what you're discussing and allowing the clinician to understand better what the patient understands. And so the patient is able to participate in the decision making even better. And this also means that at clinic visits, the person that accompanies them to the appointment should be someone who knows them well. It's also important to provide sufficient time during clinic visits, which is always a challenge, and discuss the goals and values of the patient as much as possible. Of late, there's also been an emphasis on supported decision-making for adults with intellectual disability. And so there's a new tool on the DDPCP website about advanced care planning. It's just in the COVID-19 section. And I think I'm really encouraging everyone to take a look at that area because it is talking about using a person-centered approach to clarify the goals and values of the patient and their preferences for future healthcare, especially within this complicated time of COVID-19. Also, it made me think, the New Zealand study made me think about caring for mothers and other caregivers. And in the guidelines, this was actually a new section for the 2018 consensus guidelines discussing adding a recommendation for the care of mothers and other caregivers. So recognizing that we need to screen for caregiver needs and recommend interventions that reduce behaviors that challenge people with disabilities. Speaking of ways to increase coping and reduce stress, there are, I'm sure other people have approached this topic, but there is quite a bit of clinical evidence for mindfulness-based stress reduction programs. One example that uses a bit of mindfulness as well as other modalities is acceptance and commitment therapy, which is becoming more researched lately. Also, I would recommend patient and client-driven groups and seminars, which improve diversity and the voices that we're hearing from. So clinicians are advised to monitor for family or caregiver stress regularly. There are some standardized ways to monitor for stress. They're kind of more used for research, but you could use it in the clinic. One example is the Brief Family Distress Scale that was created by Wise and Lunsky. But I find for me, it's just an informal question in the clinic. How are things going? And I found that sometimes, especially during COVID-19, I've been surprised by the answer. I've had people say, things are actually going great. Like, since we haven't had to drive across town to go to this day program, we've had a lot more time to take walks together and we're all happy and more relaxed. Whereas other people say, it's terrible. We have lost all our structure. We're exhausted. I tried to get in touch with the ODSP worker. There's nobody there. So it's just important to understand the lay of the land before you start making recommendations. Speaking of the lay of the land, understanding the stressors in my patient population has been important. I work in the inner city with a very diverse population. A lot of my patients are people of color or racialized people. They're struggling sometimes with poverty, working in employment that has high risk of COVID-19 exposure, dealing with precarious housing, interaction with the law or child protective services, requiring education support, having difficulty with the safety of their neighborhoods, and also all the complex needs of new immigrants, which include access to coverage for their healthcare and language barriers. With respect to race, the stressors that the Black community have felt for years have recently come to the forefront through the death of George Floyd and Breonna Taylor in the United States and through the Black Lives Matter movement. So none of this is new to members like myself of the Black community, but now it's come to light for so many other people who are recognizing that this is a real problem. This is an article from Forbes magazine, and the mother explains that she fears fatal interactions with police for her children with disabilities. And she's worried that her child will be targeted because of their race, and if they were to interact with police, they might not be able to follow through with police instructions. The cultural awakening is occurring in the backdrop of a global pandemic, and that is exposing all sorts of weaknesses in our society. We know that further disparities exist with respect to Black patients and COVID-19. So in Ontario, race-based data was not collected with regards to COVID-19 until the summer of 2020. At first, Public Health Ontario was focusing on data based on neighborhoods. So they show that the most ethnoculturally diverse neighborhoods in Ontario, particularly in large urban centers, were experiencing higher rates of COVID-19 related deaths and compared to other neighborhoods that were less diverse. And COVID-19 infections in the most diverse neighborhoods were 3 times higher than in less diverse neighborhoods. They also started to recognize that people in these areas of diversity had some more severe outcomes of COVID-19, including more hospitalization, higher ICU admission, and higher death rates. So this is a headline from an article in the CBC. So Toronto Public Health began asking questions on socio-demographics characteristics of the people who were being tested for a probable or confirmed case of COVID-19. And then they could use that information to study how COVID-19 and race are interacting. So if you look here, you can see that if you identify as Black, you have 21% share of the COVID-19 cases in July, as of July 2020, whereas Black people make up 9% of the population. So the amount of people getting COVID-19 in that population is much higher than the proportion of people in that population. So you're overrepresented. Whereas if you look at people who are white, they make up 48% of Toronto's population, but only 17% of the share of COVID-19 cases. And you can see that this is also true for some other groups, like South Asian, Indo-Caribbean groups are overrepresented, Southeast Asian groups, and Arab and Middle Eastern or West Asian groups also were overrepresented in Toronto. So more recently, in a not yet published study by the African Canadian Civic Engagement Council, an innovative research group, long name, that this came out in June, but they found that Black Canadians across Canada, so not just in Ontario, were more likely to report COVID-19 symptoms and more likely to have sought treatment. And they were actually trying to delve further to understand why this might be occurring. They noted that Black Canadians were more likely to have jobs that required face-to-face interaction, and also that Black commuters were more likely to report symptoms or seek medical treatment. Anecdotally, I've noticed that many essential workers, such as support workers, DSWs, PSWs, in nursing homes and congregate living settings are people of color. And many of my patients live in housing conditions that make it very difficult to self-isolate. Studies from across the US and UK are showing the same results. And they cite ideas like economic barriers, perhaps inequitable access to medical care, health advice, and transportation issues as well. How can we encourage change? We see these disparities, right? And after the death of George Floyd and Breonna Taylor, we recognize that there are disparities. We sit here together and we're hearing the voices of Black mothers, and we're looking for ways to improve. Many of you would say, well, I am not racist, so I'm helping. And in an ideal world, I agree with you, absolutely, that overt racism should not exist. But I also believe that systemic racism would not exist either. And these disparities and barriers that we're discussing would not exist, and implicit bias would not govern our decisions. So I'm offering some ideas of ways to address this, just as a clinician who's working in the area of intellectual disability. This talk is about Black people and Black mothers, but of course it's applicable to other marginalized groups. And I think I'm thinking of people of Indigenous backgrounds, for example. And I think at this point, it's a good time to think about your community and whose voices might be missing. So consider the programming offered by your agency. Do the materials include Black people? Do they celebrate or discuss important moments for Black American Canadians in your agency? Do you offer culturally appropriate food options? Do you have a diverse music selection or for dance or fitness classes? This is a picture of my son. My family is from Trinidad and Tobago, and he's examining a Caribbean carnival costume. So in a couple months, that's something that we'll be thinking about in our family. How can we encourage change? Create publications and resources that include the images of people of color. So think of the social stories you're using, the pamphlets and handouts. I did a quick internet search, and I found these two social stories. They look lovely with beautiful pictures of people with different skin tones. This is a little more complicated. The research that I showed earlier from Toronto Public Health points out that race-based data can help address disparities, right? Because by understanding that the people in the Black community are overrepresented, targeted approaches can be made to that population with respect to COVID-19. And in fact, I see that happening. I see agencies in the Scarborough community that have been working with the Black community are actively involved in a lot of the public health measures. So I think it's important for your agencies also to think about collecting race and ethnicity-based data to monitor for health inequities and to understand the impact of health outcomes, policies, programs, and practices on these population subgroups. Also, include Black people and other marginalized groups in research and quality improvement measures. So look for diversity in your self-advocates, in your Black researchers and scholars, and in when you're studying your communities, reach out and go into communities that are more diverse. And lastly, this is the most complicated, but hire staff that reflect the diversity of your patient population and provide an inclusive culture to support diverse staff members. And there's been research on the fact that having diverse physicians, for example, improves access to care. I work in a diverse clinical environment. I think by working with people that have diverse background, we all have something different that we can share, and it's important for us to hear these voices from each other. And it's not just important to hire people that are diverse, but also to support them. So educate yourself about allyship, and there are formal training programs for this, and initiate measures to build an inclusive culture, including unconscious bias training, the use of inclusive language, and calling out inappropriate behavior when it happens. That's what it is to be an authentic ally. But I would love to see in the chat, in the Q&A box, what your organization has been doing well.
Well, thank you very much, Dr. Neil. At this point, I'm going to welcome back Dr. Canlu for some closing thoughts before we reach the Q&A. Okay, thank you so much. Dr. Neil has raised a lot of important thoughts, and I'm just going to conclude with a few more slides. If you recall that we had this slide at the beginning of today's webinar, and I find intersectionality a helpful way of thinking, a helpful way to analyze issues, and you may want to consider it in trying to address some of the points that we're raising today. So, for example, our context now, we're under wave 2 of the COVID-19 pandemic. In terms of our identities as parents, as service providers, as persons with disability, all of these have implications in terms of how much power we have or how little we have vis-a-vis getting the services we needed through the different sectors, getting the supports we needed. So I find it a useful way of thinking. And for those of you who are interested to learn more about it, Women's Exchange at Women's College Hospital has put together an excellent e-module on intersectionality as a research lens. And the URL is provided on that slide if at some point you'd like to take the module, the e-module. So just in terms of looking at the COVID-19's impact on people with disabilities, and again, putting that intersectionality hat on, we know that in the context of the current pandemic, people with disabilities face increased risks of exposure, complications, and death, according to the United Nations Children's Fund. They also face accessibility barriers to prevention
and response measures. And yet we have limited data on people with disabilities, which results in challenges to surveillance systems to precisely determine the impact of pandemics, including the COVID-19 pandemic. So example of multiple levels of challenges and marginalizations, which may lead to differential and negative impacts. In terms of the different identities such as gender, race, ethnicity, socioeconomic status, sex, migration status, and disability, they both shape how the impact of the pandemic affects populations, as well as their resilience capacities. We know that people with disabilities have historically been socially and economically excluded. They face multiple social and economic barriers that can negatively impact their health and mental well-being. And yet also we want to underscore that a layer of complexity is added when we look at the experiences of racialized families who have members with developmental disabilities. And on top of that, the current pandemic is exacerbating these health inequities among particular populations. So on the slide, you'll have links to our office and some of the research that we produce in this area. And I want to end on our final question for today is, in your opinion, how can service providers support the well-being of Black mothers raising children on the autism spectrum during the COVID-19 pandemic? So we'll leave you with that question. And thank you very much, both on behalf of myself and Dr. Neil.
Thank you both, Dr. Kane and Dr. Neil. At this point, we will pause and we will be right back live to answer your questions. And we are back. So I will welcome back both Dr. Kanalou and Dr. Neil back live. We've had a bit of a wardrobe change, but that's okay. So we have a few questions here, and our audience was active in the comment section as well. I want to remind our audience, continue to submit your questions. We've got at least 13 minutes, maybe a bit longer, so that we can get you those answers. And I also want to point out that in the handouts, which you see open, there are a few handouts there that you may want to access, including the PowerPoint slides. There were some links in there, information on the primary care program, and of course, our upcoming webinars and past webinars. The links are all in there. You may have to scroll. So thanks so much for the presentation once again. The first question that we have is, what do you plan to do with the results of this study? And how do you see this impacting the Black community and the service provider community? A bit of a big one there, so I'll throw it out to both of you to take a shot at it.
Thank you for that question. I saw it and I thought, what a great question. So we have what Dr. Neil and I have been doing. Actually, this is not the first time we're presenting on the study. We have presented to both service providers and healthcare professionals in Canada and the US. So our aim is first education. We feel that in the developmental disabilities field, and Dr. Neil can add on to this, is more attention needs to be given to various diverse groups, including racialized families, Black families, and at present our education is not addressing this sufficiently, so education is important. And we hope that service providers in venues like today are able to take some of the suggestions we're making and implementing it into their practice. Personally, I hope, as a researcher, I hope other research colleagues will more actively include diverse populations into their research projects when they're looking at various aspects of developmental disabilities, mental health field, healthcare field, so that our studies more truly reflect the diverse populations that we're serving. Dr. Neal, if you want to add on to that, please go ahead.
No, I agree with you. I think education is really important. And for myself, even just personally, it made me feel like I needed to push myself a little further to try and explore some of these areas of research that are leaving out the community that I like to serve in Scarborough, for example. So I think trying to encourage research out in the community and not just at the larger academic centers is really important.
Excellent, excellent. Okay, so our next question talks about, I guess, inclusion just a little bit. The study was focused on mothers. Is there a reason that you didn't include fathers or sort of the full family unit in this study?
Thank you for that question. So in another study, which was larger, it included fathers, and that was more comparative in nature. Different studies have different research questions that they try and address, and I encourage and we'd be delighted if those participants today check out our website. We try and put most of the activities that we engage in on the website. This particular study kind of didn't come out of the blue. Through a series of previous community-based events where we were sharing results of our other studies, we heard that we need to focus on health promotion for mothers, mothers from diverse backgrounds, and particularly focus on the experiences of Black mothers raising children with developmental disabilities, because they have unique resiliences, strengths, but also unique challenges. So this study builds on in terms of what the community told us when we presented in different venues, and respecting the feedback that we got from the mothers who came to our community events, and building on what we thought was important and frankly missing both in the research literature and perhaps in policies around good practices for diverse populations.
Dr. Neal, do you have anything to add to that?
No, Nazila said it very well.
Perfect. Maybe just a quick follow-up on that, since there is another sort of comprehensive study that does include fathers and the like. Did you find any large discrepancies between this study that was mothers only and the more comprehensive study that included fathers?
So perhaps we'll come back and talk about that study at another point. That study was focusing on and was funded by a different funder. And in that study, we looked at mothers and fathers, and we also looked at immigrant families and Canadian-born families. And the focus of that was on challenges in terms of finances in getting services for families. And so we were very pleased. I don't want to take up too much of the focus for today, because it's a specific focus. We were quite grateful for the fathers who did come and hold interviews with us. It is a bit more challenging to recruit fathers into the studies than mothers. We have to be very active and seek ways where fathers do and come and are interviewed. But it was a great learning experience for us. We learned how involved the fathers who came to the interviews were in helping and raising their children with developmental disabilities. And So yeah, maybe another day for that study. I don't want to take away too much about the attention from today's focus.
Okay. This question's a long one, so I'll read it out and let either of you jump in as you see fit. What is a good way for clinicians to ask questions during intake or clinical interviewing to understand the impact of race, ethnocultural factors on one's psychological health and well-being? Literacy levels of parents, all of these have implications on participation in therapies and prognosis. So maybe you can both take a shot at that one.
Oh, I have a thought or two. I think a lot of clinicians might feel nervous because you don't want to ask a question that maybe implies that you are expecting someone to have a particular education level or a specific stressor, right? Because we don't know everyone when we first meet them. I think having standardized questions that you actually ask everyone sort of alleviates that, so that you can say, these are just things that I ask everyone. I'd like to know a little bit more about you and your family. I have a very standardized intake form that I use every time I ask questions about the parents, where they're from, what's primary languages they use at home, level of education of both parents, and then I always ask informal questions about like stressors in their life, how are things going, are there things that they need help with that are not necessarily that doesn't seem directly related to the clinic. And I think a lot of people realize that I'm interested and open to those questions, especially because I start asking questions about income supports, questions about, where have you applied for your disability tax credit? Have you done your referral to the Developmental Services Ontario for transitional aged youth? So if I'm asking all these questions, I think people realize that I'm trying to get the big picture, and they're more open to discussing these other issues.
So maybe I can phrase that question in a different way, and I'm not sure if you already addressed it because I'm not myself an MD and doing intake, but what do you think are some of the questions that you've added to your standard intake form that take into account racial diversity and the various items that are going on that some other professionals may not have on their forms today? Because you'd mentioned you think it should be standardized and that you use a standard one, but what do you think you've augmented in your process as due to the communities that you support?
So there are two ways that I'm doing that. First of all, our organization has the policy of collecting socioeconomic and race-based information. So we do that for everybody. So all patients, we ask about their racial background, their household income, and information about immigration, all those things. However, it's standardized. It's not compulsory, but we do ask if they're interested in sharing that information, and it helps us to direct services within our organization. And then personally, each clinician has their own way that they do their intake for their patients. And for my own intake, I include all of those questions about things related specifically to autism and intellectual disability, income supports, and then also learning more about the background, both the racial background, education background of the parents and caregivers, and also I also like to learn a lot about the level of function of the person that I'm caring for. So I usually do some questions about activities of daily living, so ADLs they call it. So asking, are you able to dress yourself? Do you feed yourself? All these kind of more specific things to understand better how we can communicate. Oh, and that's another thing for communication. I like to ask questions specifically, like how do you like people to explain things to you? Do you like short explanations? Do you like me to write it down or draw a picture? And how best do you communicate with me? Do you use a communication board? Do you use short sentences so that I can understand better. I also do ask questions about thinking about being patient-centered. So, what are some barriers to coming into the clinic? For example, I was saying, waiting in the waiting room is a barrier for some people. Some people have phobias of needles or certain clinical exposures in the past that have been traumatic. So I like to know about all of that in my intake.
Excellent. And with that, we've come to the end of the hour. I do want to give you both an opportunity. If there's anything that you didn't say that you'd like to say, or if our audience could walk away with one message from you guys today, what would you like to say to our audience before we sign off for the day?
Shall I go first, Dr. Neil?
Sure.
Okay, so just drawing on not just this study, but a number of projects that we've been involved with is when we also include service providers, is we find that at times service providers attribute some of the behaviors of the family, the parents, to more cultural reasons, but when we actually interview fathers, mothers, persons with disabilities, they're really talking about the structural or systems challenges, the interlocking challenges of not having enough employment, of services not being equitably available. So I think one lesson, and my background's nursing, so my background is psychiatric nursing, is for us service providers to recognize that not everything is cultural and to look for reasons that are more systemic and perhaps structural. So that's one thought that I'd like to leave with. I don't know if Dr. Neil, you want to add on to that or have other points?
I think for my thought, it's not to be nervous or embarrassed if you're Black or person of color who is receiving care, to ask for some of these things that we're discussing today. I think sometimes we feel intimidated in clinical encounters or when we're in these situations where we're receiving care, but we do need to make things better, not just for ourselves, but for all people of color. So asking is the first step.
And with that, thank you so much to our distinguished panel here and to all of you for participating in this webinar. If you know of anyone who you think might benefit from the content that we have been talking about today, then please share this link. This event will be available on demand tomorrow at this URL. And you can also go to the Autism Ontario website. Link is in the handouts where we host all of our on-demand content. The more people that we get coming through this program, the more webinars we're able to put on just like this one to help benefit you and the community. Before you leave, make sure to check out the handouts for the presentation, upcoming webinars, as well as the primary care website. And with that, I'd like to thank everyone for your participation, and we look forward to seeing you again on our next Autism